This PowerPoint will discuss prophylactic probiotics to decrease the incidence of C. diff. This PowerPoint will discuss C. diff is a debilitating disease with symptoms including fever, nausea, abdominal pain, and most notably, watery diarrhea. C. diff negatively affects the lives of many patients. Untreated C. diff can lead to dangerous electrolyte imbalances, toxic megacolon, perforation of the bowel, sepsis, septic shock, and even death. The incidence of C. diff is over 500,000 cases per year, and the United States spends on average $5.4 to $6.3 million per year on C. diff related costs. Probiotics are living microorganisms capable of assisting with the normalization of gastrointestinal flora, which can lead to the prevention of C. diff. Given this knowledge, the creation of this benchmark project to implement prophylactic probiotics to patients receiving antibiotics was created. There is overwhelming evidence that show the positive effects of probiotics on the decrease of C. diff. In the literature, there were many systemic reviews and meta-analyses, along with randomized controlled trials that were conducted. These shows that probiotics given with antibiotics reduced the risk of C. diff. Here are many studies that were performed that showed the success of probiotics. Practice, and I'm familiar with new evidence. The many stakeholders in this project. Stakeholders' resistance to change must be assessed early and typically results from elements including hesitancy to change traditional practice, and I'm familiar with new evidence. The main stakeholders in this project would be the unit manager, the VP of Surgical Services, the care team, the direct patient care, and of course, the patients. The physicians will be needed to prescribe the probiotics to the patients receiving the antibiotics. Registered dietitians will be needed to ensure that proper probiotics can be given to the patients. And then the entire patient care staff, including the nurses and nurse techs, who will be monitoring the patients, reporting diarrhea, and advocating for C. diff tests whenever it is necessary. Overall, all these people will need to work together in order to accomplish this project. Here's a timetable of all the events that must occur. During week 1, it will be time to set up a meeting with the SICU unit managers, VP of Surgical Services, and physicians to gain approval to perform this project. It will also be the time to recruit volunteers to join the committee and become probiotic champions. During week 2 through week 13 will be the time to gather baseline data on the current instances of C. diff. This will also be the time to perform education and in-services to all the staff and physicians regarding this implementation. This will also be the time to order larger volumes of Glutapac R to stock on the unit. During week 14 through 25 will be the implementation. This will be when we will conduct the project and implement probiotics into the treatment plans of all patients receiving probiotics. After this is finished, during week 26 will be the time to evaluate the performance. This will be the time to compare the two results from the pre-implementation to the post-implementation to determine if the implementation was successful. Data collection will be performed by the probiotic champions. A master document will be created, and each patient's start on antibiotics will be tracked. Information including each patient's start and stop dates, the type of antibiotic, the adverse effects, if there was a test for CDI, and of course if there was a CDI occurrence. There will be one created for the baseline data and one created for the post-probiotic implementation. The occurrence of CDI will be tracked through the reports from the lab on positive C. diff toxin A and B tests. Champions will be assigned certain days to update this document so that it is current at all times and no occurrence of CDI is missed. Evaluating outcome measures after a change has been implemented is important to determine if the research findings were translated into actual clinical practice settings. In order to establish baseline information on the current rates of CDI, and all patients receiving antibiotics will be tracked over a 3-month period. Determining the frequency will be completed by simply counting the number of times the variable of a positive C. diff test occurs. To calculate the percentage, the total frequency of CDI occurrences will be divided by the total number of patients started on antibiotics. Then the number will be multiplied times 100. This will show the current percentage of CDI occurrences and will become the baseline data. After the intervention is completed, we will look over the results and determine the frequency after the intervention is made. The results will then be compared with the previous pre-implementation data to evaluate the effectiveness. In order for there to be success in the project, there must be a 25% decrease in the rate of CDI in the post-intervention group versus the pre-intervention group. Can greatly improve the quality of life of these patients. It is difficult to determine the exact cost of this project as the number of patients that will be prescribed antibiotics is unknown. The members of the committee will be able to perform their tasks during their normal scheduled shift, so no additional costs will be needed for their services. The daily cost of Glutapac R is right under $3. Each patient prescribed antibiotics will receive it during their duration of their therapy. These will be patient charges just like any other medication and will not lead to a major ongoing cost for the hospital. The average cost of one case of CDI is $20,085, making the cost of probiotics minute in comparison. If one patient develops C. diff during the course of their stay, the cost of isolation can range from $400 to $2,000 per patient per day. The benefits of this project have the potential to be very significant and therefore far outweigh the costs associated. C. diff also leads to many undesirable outcomes, including increased morbidity, mortality, medical bills, and hospital stays. When a patient develops C. diff during the course of the stay, it can complicate the recovery and lead to discomfort and feelings of embarrassment. Overall, this project can greatly improve the quality of life of these patients. The overall goal of this project is to decrease the rate of C. diff in an ICU. In numerous trials and reviews, probiotic administration showed a decrease in C. diff and C. diff-associated diarrhea, with no significant increase in adverse effects, leading to anticipation of success with this evidence-based change. Success of the project will be reflected by a decrease in the incidence of C. diff by 25%. If the change leads to positive outcomes, it will show that there should be a change to the current practice. If the results are not statistically significant, but show a decrease in the rate of CDI, a longer trial should be completed to see if a larger sample size will show significant results. After reviewing the results of the project, it will be important to deliver the outcomes to management so that permanent changes can be put into practice. Evidence from scholarly research should drive the decisions and changes we make in the clinical practice. If success was proven by this project, it is crucial to disseminate that information. The next steps would be developing new policies and procedures to permanently prescribe probiotics to patients receiving antibiotics. Hopefully, this information would be taken to the hospital-wide meetings with representation from each unit to encourage other units around the hospital to make these changes as well. The goal is to make a permanent change to the way we currently do things based off of evidence-based research.